So ladies and gentlemen, our next panel discussion for today is India investing enough in healthcare. We're very pleased and honored to welcome our speakers for this particular panel discussion. We have with us Dr. Anbumani Ramadoss, former Union Minister, Dr. Georgi Abraham, Consultant-Nephrologist, Madras Medical Mission, Dr. Sunil Thomas Chandy, Director CMC Vellore, and our chairperson for this panel discussion, Dr. S. Gurushankar, Chairman, Meenakshi Mission Hospital. I request all of you to kindly join me on stage. A warm round of applause, ladies and gentlemen, as we welcome our next set of panelists onto the stage. Is India investing enough in healthcare? That's what they're going to be debating about. Once again, we shall begin with the chairperson who will express his point of view and then move forward to each speaker who will be given about 8 to 10 minutes. So in under 10 minutes, we'll move forward to the next speaker, post which there will be a group discussion amongst them. And right at the end, the floor will be opened for a quick Q&A session. I now hand over the floor to Dr. Gurushankar. Over to you.
Good morning, friends. It's indeed a great session, the one we had before this. And there was something related to healthcare in it. When they were discussing, Kancha Ilaya was talking about being a vegetarian and how being a vegetarian makes a person a little weaker than a non-vegetarian person, and about the strength he builds in himself. And he said maybe being a vegetarian is anti-national. And then I was just thinking, I was wondering, we have a bunch of doctors, if being a vegetarian is healthy, then does it mean that being healthy is anti-national? So it's just that I'm telling this on a lighter note, but what he meant is probably having a low protein diet when you are a vegetarian. So I was looking at all the topics today and all the topics yesterday, and I feel that this is the greatest topic which we are going to discuss, because it's about health. Friends, you can have any amount of money, you can have any amount of power, you can have any amount of fame and recognition. You can be the king or queen of a country, MPs and MLAs can fall at your feet, but if your health is lost, everything is lost. So let's agree that health is the most important asset of an individual, of a country, and we need to focus on it. And we need to make sure that we have healthy individuals and we have a healthier country. And we have 3 wonderful speakers. You know about them, and let me tell some brief stuff about them. But before going into it, when you look at the topic is India investing enough in healthcare? Now, to answer this topic, we have 3 eminent speakers, so I'm not going to go into it. But before we go and dig deep into this topic, we need to realize the present situation of the healthcare industry in this country, the present situation of the healthcare scenario in this country. And I would like to quote a recent incident that has happened in Tamil Nadu. All of you know about it. It's about our late Chief Minister, Jayalalitha. So she got admitted in a private hospital a couple of months back, right? We all know about it. At the same time, the leader of opposition, Kalaignar Karunanidhi, was also admitted in another private hospital in Chennai. Both of them have been ruling the state, one after the other, for several decades. And they have been controlling the quality of government hospitals in the state. But when a situation comes to take care of their own health, the leader of a state chooses a private hospital and not a government hospital. Well, that is the situation. That is the situation of our country. Our government hospitals are run at such quality. And I don't want to say at what quality they are being run. I think their actions have proved it. And there was another incident that happened subsequently after that. Unfortunately, she expired. We all know about it. And there was a press meet conducted. And when questions were thrown at the doctors, they were answering it. And one of the questions was about the quantum of the bill that was paid by the late Chief Minister. And he said that the bill was 5 crores and 50 lakhs for the treatment. Now, I run a hospital in Madurai, and we do some charitable work. It's a 1,000-bedded hospital. And one of the charitable work we do is we treat kids with cancer, absolutely free of cost. And we decided to do it. We decided to do it because we see patients who come in who can't even afford 500 rupees to save their kid's life. So on one end of the spectrum, you have people who can't even afford 500 rupees. And at the other end of the spectrum, we have people who can afford 500 lakhs. And now, look at the gap between the quality of healthcare that is given to someone who can afford it and the quality of healthcare to someone who can't afford it. There is no question about the amount of money spent to save the life of our late Chief Minister. Obviously, her life is precious. We miss her and we needed her. And there's no question about should we spend this much money on it. But at the same time, the life of a common man is as important as the life of a Chief Minister of a state. In no way the life of a common man or an individual in the state is less important than the Chief Minister or a head of a state. That is how a civilized society has to be. Are we living in a country like that? Affordability is a big issue in this country. And healthcare is divided between rich and poor. Another big challenge is healthcare being different between someone who's living in an urban area like Chennai and someone who's living in a rural area like Tanjavur. There are so many people who live in villages who don't have enough access to quality healthcare. So there are huge challenges. We have challenges with doctors, we have challenges with nurses. We don't have enough doctors in this country, we don't have enough nurses. As per McKinsey's report, India will be in shortage of 5 million hospital beds by 2020. And that's a huge number. And remember, most of Indians, most of us are youngsters. And as we move, as we get older, the incidence of every disease in this country is going to go up. And are we going to cater to that? Do we have enough hospitals for that? So I leave all these questions and I will create this context for our speakers because they have much more larger experience about this. Friends, to sum it up, there's a big difference and there are two big challenges in today's healthcare. One is affordability and other is accessibility. Rich and poor get two different treatment. Urban and rural get two different treatment. So this has to be bridged. And how are we going to do it? Most of you are youngsters and let us see that at least 20 years from now or 30 years from now, at some point of time in our life, we need to create a country, we need to create a system where irrespective of a person's financial ability, irrespective of a person's demographic location, he should have access to quality health care. And that is how a civilized country and that is how a developed country can progress. Like UK, where they have NHS, like Singapore, like Australia and New Zealand, where the government pays for it. And let's have this goal in our mind and let's discuss, is India investing enough in healthcare to reach this goal? And I would first invite Dr. Sunil Thomas Chandy, CMC Vellore, because he has been pioneer in providing rural healthcare in his own area. And in fact, being a private healthcare provider, he was able to take healthcare to rural regions. And in fact, when I recruit doctors from a hospital, when I see they are from CMC Vellore, there's no interview conducted. It's like guaranteed that they are great doctors and you just recruit them. So that's a big institution. So after that, we can have Dr. Anbumani Ramadoss. He did a great job in National Rural Health Mission. It was appreciated globally and that he can share your experiences on it. And finally, my professor, Dr. Georgi, he is a nephrologist and the founder of Tanker Foundation. And we can have a positive discussion about it. And in the end, we'll take the Q&A. The speakers can either come here or you can speak from there. It's up to you. Thank you.
From the ancient days of Charaka, Sushruta and Dhanvantri, the pioneers of Indian healthcare, to an India now which has been led thus far on the shoulders of giants, to this year, 2017, where we have scenarios like this at the gates of certain public hospitals, or very recently in Gorakhpur, where there was an epidemic of Jab-B encephalitis, which left several children dead and several maimed for life. Something is not quite right in Indian healthcare, and that's obvious from the preamble comments of our chairperson. And that is the reason why this topic is being brainstormed today in this forum. Is India investing enough in healthcare? In 2017, we have an India that is a whole lot different than what it was 10 years ago. Our population is at the brink of 1.3 billion. We are an economy which we claim is booming. We have rapid urbanization, which has had its impact on health. There are social gaps that are meant to shrink but are actually widening. There is a decline very clearly in our ethical values of society, not just in governance but also in healthcare. And most importantly, there is a rapid change in the profile of diseases that we are seeing in India. And therefore, I want to address three health paradoxes as a preamble to our discussion. Paradox one is that we in India are the largest producers of doctors for the whole world. We produce close to 65 or even 70,000 doctors a year, and we supply a good chunk of them to the West. But the truth, the sad truth, is that we do not have enough doctors for India, as Guru has just alluded. As we speak, we are 2 lakh doctors short, and we could do well with that. The second paradox is that healthcare is today referred to as industry. Is it thriving as a business? The answer is yes. Because this is a $1.3 trillion platform, and everybody wants to have a finger in that pie. It is growing at 18%, which is close to information technology. And therefore, there are several players or stakeholders who want to be involved. Construction industry, software industry, device industry, pharma industry, equipment industry, financing, venture capitalists. They all look at healthcare as an easy source of business. Profit, unfortunately, for this model is the only motive for healthcare. So is it thriving or robust as a service? We know that public health is in shambles in India, and it's been alluded to with a GDP of 1.03%. 70% of those patients who you see spend out of their pocket, and there's very little in it. Private care is unreasonable, inaccessible, unaffordable, unethical. Insurance penetration in the best of times is less than 10%, and there is a very wide urban-rural skew, and the demand-supply mismatch, despite all the progress that we've made with private healthcare and the public health system, is only widening as we go on. This is how it looks in a general hospital, where patients are under the bed, by the side of the bed, apart from being in those few numbers over the bed itself. The third paradox is that healthcare is really for the rich and affordable in India. That's the way it is evolving. This is an example of the 5-star hospitals that you see, which will offer the best that you can get anywhere in the world. But is it the same for the poor, for the cashless, and now, after demonetization, the cardless? The answer is no, because this is what you see in general hospitals. There are also contradictions. Medical tourism, which we now bandy about to the whole world as the preferred destination, India, has got major contradictions when you put what lies in the foreground of these airports where these planes land. These are slums where people do not have food to eat or not even money to buy one strip of paracetamol. What we keep hearing in India is this: India is shining, India is incredible, and there's no doubt that it is true. We also hear that we are the fastest growing economy, growing at 7.1%. We are the largest country with intellectual capital. We are the preferred destination for medical tourism, and we export expertise, whether it's IT, pharma, minerals, automobiles, or even skilled or semi-skilled labor. All this is true, and we are very proud of it. But what we don't hear is the sad truth, that our public health care is in shambles. We have a decay in our ethical values in healthcare. Our collective conscience and social sensitivities are decaying. Our civic sense, and we can see that as we step onto our roads, is very bad, and the political will to correct anything is lacking. We are suffering, and probably the largest country with a dual disease burden, and that's a point of struggle. Our lifestyles, starting from our children, the way they go to school and the food they eat, enshrines unhealthy and dangerous lifestyles. This is New Delhi last year in the month of November, the capital of our nation, where people were not able to breathe. Air, which is meant to be free and clean, was not so in the month of November 2016. It was polluted, it was choked, and it was definitely unlivable. There are other cities where this is what you see from the top of a building, where machines and vehicles are going to overtake human beings and make survival difficult. This is India for us, where we add to the global burden of the world, disease burden of the world, in a very significant way. There are 2.5 million cases of tuberculosis, and quite a few of them have got multi-drug resistant organisms. 3 million, I am told, stay undetected. We have the highest number of tuberculosis in the world, followed by Indonesia and China. And there are outbreaks of dengue, Jappy, swine flu, which become sporadic epidemics which we really struggle with. And as the WHO warns us, we are on the brink, on the cusps of a non-communicable disease disaster, an epidemic for which we are not prepared. The health indicators, which we see all over on the internet, actually show that we are just ahead of Pakistan. Even some of our neighboring countries have overtaken us in terms of those crucial health parameters. It is true that in the hinterland of India, somewhere in some identified Indian village, there are hospitals and clinics that manage with one bowl of boiled water for the whole day's surgical list. It's also true that there is only one pair of gloves available in some distant villages with which they manage an entire day's surgical work. So therefore the question is, are we a healthy nation? We are the heart disease capital of the world, the diabetic capital of the world, the accident capital of the world, having just taken Manila as the highest number of road traffic morbidity and mortality in the whole world. We are the TB capital of the world, just four of the many other capitals that we can sadly claim to be. The demographics show that we have a big problem. We have 30 million children being added to India every year. We are the largest under 5 population of the world, the largest under 15s, and the largest under 40 population of the entire world. And very soon, in about 7 years, we will be the world's largest geriatric population, just behind China. We are witnessing the effects of dual burden. Apart from still tackling with major tuberculosis, malaria, filaria problem, we also have the world's significant share of lifestyle diseases, metabolic diseases, the surge in cancers even in young people, psychiatric disorders. Suicide is supposed to be the highest in the entire world reported. Emergencies, hospitals are full of acute care problems. And then there is road traffic accidents. Because of this, cauldrons of death that we see on our roads, where we get injuries like this, which can't even viewable, or disability, which might leave not only the person, but the entire family devastated for life. The linkages between healthcare and poverty is established. This is a government statement that healthcare costs in India are the leading cause of poverty, and poverty is the leading cause of ill health in India. If you link the two, you can imagine the negative cascade that we as a country are into. So the question is India investing? Not enough. That is the plain and simple answer. Actually, the healthcare needs of the people are very simple, and our chairman has alluded to that. It does not have to be hi-fi. We need to have healthcare workers and our systems with these 4 A's: availability, accessibility, affordability, and attitude. And it's a combination of this that will really turn things around for our country. I want to present before you 7 desirable health investments. And this is a new paradigm where we are just not talking about money. Money, of course, is needed. The first C is cash and capital. With a 1.03% GDP, we are not doing too well. We have to make it 4 times if we are to meet the just current needs of our nation. Cash is not enough. We need to have capacity in terms of infrastructure and manpower. We need investment in competence. Today's young doctors do not have hands-on skill. They are more theoretical and more techno-based and more investigational. But we need to make them clinicians, and that is a government's responsibility. We need to invest in commitment, and this is a big deficit that we have in the medical fraternity. And we need to have colleges not in cities anymore, but we need to plant every medical college in villages, as far away from cities as possible, if we want to have a generation of doctors who are connected to the real India, to the real disease melting pot, which is in the villages, not in the cities. And of course, community, where every aspect of our training has to be on the ground, on the field, not in air-conditioned classrooms, which is what the practice is in our nation. We need to scale up by building available facilities, ramp them up, by building appropriate manpower, by buying appropriate technology, knowing that more than 50% of the technology that we use in medicine may not really have too much of relevance from a service perspective. And of course, bridge those affordability gaps. Do you really need to have 5-star infrastructure like this? The formula of healthcare in the private setup, you won't even be able to make out whether this is a hotel or a hospital, except by looking at that trolley over there. Not necessary. What is needed from the government is to build appropriate infrastructure like this, which is more than enough to give quality health care. You can have a treatment room which just looks like this, but meets the standards of hospital care. Alongside investments, I would submit 3 disinvestments that we as a nation must do. We have to disinvest aggressively corruption, which has taken over the medical health field. We have to put a media blitz against commercialization, because this is what has rendered healthcare ineffective and untrustworthy. And we really have to simplify healthcare, and it can be done by cutting down bureaucracy and regulatory tangles that we suffer from, and also to cut down the technology invasion that healthcare has been hijacked into. You might wonder what happened to the 7th C. None of these will have any effect if we don't instill in our new generation of health workers the 7th and the most important C, and that's compassion. Today, healthcare is an industry, it's a business. It's a means of making money, and as somebody described, it is a set of people who are making money out of human misery. That is true. And therefore, we need to have compassion. I'm not sure whether this video will play. But this is an example of a real life example where a man was forced to carry his wife's dead. Friends, this is our country 70 years after independence. And I want to submit to you that we can turn things around if we build those 7 C's as our 7 steps to investing into India's healthcare. Thank you.
Thank you. Thank you, sir. It was a wonderful, it's a wonderful session where you covered the difference between what a rich man gets and what a poor man gets. You also covered about what kind of hospitals India needs. We don't need 5-star hospitals, but we need hospitals to actually treat people in large numbers and give them quality treatment and make a difference in their lives. So one of another major issue or a hurdle in having those kind of hospitals here is in India we have first world regulatory structures with third world infrastructure. If you look at the laws that says how a hospital has to be run and what are the regulations to be followed, I think even hospitals in US, they don't have those kind of regulations or structures. But we have those kind of first world regulatory structures with third world infrastructures, which is practically not possible. And people find one way or another to dodge it and do things as per their wish. So now next we have is a man who changed those regulatory norms, who made things easier for people to access. His work on National Rural Health Mission, his work on road traffic, in bringing down, the care of, bringing up the care of given to road traffic accident victims through the 108 ambulatory services. And most importantly, his anti-smoking campaign, which has extremely strengthened the preventive health of our country, goes to Dr. Anbumani Ramadoss. We would like to hear from you, sir, about your views on it.
Thank you, Guru. And I'd like to congratulate Dr. Chandy for giving us a wonderful presentation. See, firstly, we have to understand what is healthcare. Healthcare is not just building fancy hospitals. Healthcare is preventing people from going to the hospitals. And how do you prevent it? By giving them good, clean drinking water. If you give them clean drinking water, you can reduce 50% of India's cholera, typhoid, and all communicable diseases. By giving them good nutrition. If you give them good nutrition, you can bring up the immunity level more so that they don't get all these diseases. If you give them good environment, so that they're not affected by all these issues like GDP increases every year. But the catch here is, out of 6%, only 1% is from the government. 5% is from the individual. Compared to Germany, Germany invests 11.5% of its GDP in health. But the difference between Germany and India is, out of that, 88% is from the government of Germany. And for the rest, 12% they have health insurance. So in Germany, not one individual spends out of his pocket for health. But in India, it's nearly about 80% of people spend out of their pocket for health. We can have fancy surveys which has been going on, which says that the highest reason for rural indebtedness is spending on health. It's not for farming or not for housing, not for education, not for anything, but health. So this is where we are far behind. And in fact, when I was the minister at the time, before I joined, the investment was about 0.8%, and then when I relinquished, it was about 1.2%, but still not enough. Today, we need a realistic, at least 3% of investment in health of the GDP, because he has also said in his slides that India's infant mortality rate today is about 40 per 1,000 live births. But Sri Lanka's IMR is about 8.5%. Bangladesh's is about 31. Nepal is about 40, equal to India. But then when you say India has become a smart India and all these fancy words you use, and India can become the fastest growing economy, all that. But you see the last 3 years, the government of India has not invested more in health. In fact, in the last 2 years, the budget for the health sector has decreased. It's decreased. Can you imagine? So here, even though health is a state subject, coming to Tamil Nadu is also, the GSDP of Tamil Nadu is about 13.5 lakh crores. But then the investment of Tamil Nadu government in health again is about 1.3% of the GSDP. So we have, one side we have these parameters, on the other side we have fancy words of smart India. But again, we have to introspect, where is the problem? And today's topic, therein lies the answer. Is India investing in healthcare? Absolutely no. Absolutely no. And this is where we have to. I mean, everything in India, because India is 1/6 of the world's population. So when you take into numbers, saying that India is diabetic capital of the world, tuberculosis capital of the world, heart disease capital of the world, yes, it is, because sheer numbers. But again, India also has the other side also, flip side also. There have been success stories in India as well. Like today, India has eradicated polio. Not eliminated, eradicated. India has not had the polio case for the last 5 years. It's a huge achievement done by India, where in a single day, 300 million children have been vaccinated in a single day. I mean, 300 million is the total population of the United States. So this is sheer hard work of people as well. Like. But then going back to the other issues about the mortality or the maternal mortality, coming back again to what Dr. Chandy has said that, yes, are we taking care of our mothers? No. Nearly about 150 women or mothers to be die during childbirth for about 100,000 deliveries. So it is shameful on us. Yes, I was also part of the structure. I tried my best to bring out changes. We launched a program called National Rural Health Mission. The program itself is called the National Rural Health Mission. And I'd like to say that 10 years from the program National Rural Health Mission, in the last decade, India has reduced its maternal mortality by 50%. Its infant mortality by 55%. Yes, I mean, it has never happened. And because of this program which we have launched in April 12th, 2005. And today, I may say it's not enough, but then I could say that, yes, there have been resources pumped into the primary health centers, the sub-centers, the community health centers. But then on the other side also, we need personnel. Like Dr. Guru had said, like, we have about 9.5 lakh doctors, and these doctors are modern system medicine practicing doctors. But we need 18 lakh doctors. We need to double it. We have about 17 lakh nurses. We need 30 lakh nurses to take care of it. WHO's parameters for patient or not patient, people-doctor ratio is about 700 people for one doctor for 700 population. But unfortunately, we have about one doctor per 1700 population. So we need to bring this gap, narrow this gap. We have about 460 medical colleges producing 63,000 doctors, not every year, but admitting them. But is it enough? No. There are 600 districts in India, and half of them don't have medical colleges. All these colleges are tied up in the urban sector. So we need to churn out that. Dr. Abraham is a nephrologist. And we all know that India again is the kidney disease capital of the world thanks to diabetes. And you know how many nephrologists are there in India? To take care of 1.25 billion population? Hardly about 5,000.
1,580.
1,580. I mean, earlier I thought it was about 2,500 about 4 years back, but so that is the sorry state of affairs. We produce about 60,000 doctors, but then we come to post-graduation. Nearly it's about 1/3 of post-graduation seats. So there are issues in that. We need to churn out more personnel to go into rural areas. And out of 1,800 nephrologists, I'm sure 1,840 nephrologists, I'm sure 1,800 would be in only cities. And only 40 would be in the rural areas. And India is what? It's about 60-70% in the rural areas. When I was minister, I brought in a program so that all the doctors should work in a rural area for 1 year. But then, again, there were all the other issues, and there were a lot of pressures, and then that issue was scuttled down. So, to bring about a change in India, I mean, it's next to impossible. So, that is again, because I was part of the system, I knew I had to fight the system to bring about changes. To bring about changes in tobacco laws. You know which is the biggest killer in India? Alcohol. Second biggest killer in India? Tobacco. Third biggest killer? Non-communicable diseases. 18 lakh people die due to alcohol in India, directly and indirectly. 18 lakh people a year. 10 lakh people die due to tobacco in India. So you have 28 lakh people dying every year in India just by alcohol and tobacco. Why can't we do away with both of them? We have to fight the system. So we need to focus where is the problem and bring out solutions to that instead of beating around the bush. And to bring a change in India, I reiterate, it's completely next to impossible. So people also are oriented or disoriented, saying that why? Alcohol, no, it's my right to drink. Tobacco, it's my right to smoke. But then it's not the duty of the government to sell alcohol. Government has to give you free healthcare, free education, good roads, good water, good electricity, good housing. Not to sell alcohol. Unfortunately, that's been done here in Tamil Nadu. Shameful. So when we address all these issues, then we can prevent people getting into these hospitals, going to these hospitals. That is what is needed. That change of mindset is needed. Invest in social sectors, invest in parameters, invest in education, invest in water, sanitation, nutrition. Unfortunately, the current government also is not doing this. Investing in our ITs, investing in smart India, cashless economy, all that. Put money into the sector. This is what is needed. Give them generic medicines, the exorbitant costs of medicines. Same medicine, Cipla manufactures the medicine for 200 rupees. The same could be got for 8 rupees, the generic, the same quality. So this is what is needed to the people. And of course, health insurance. That is something which we have to take care of it. So, I mean, Guru, I think I'll stop. Yeah, I'll go on and on. There are a lot of, I could see some of sleepy faces out there, some of hungry also. And I can take some questions later on. So I'll just, once again, I'll just sum up in the healthcare, India needs lots and tons of investments, like what has been done by the other developed countries like Germany or UK. We have a fantastic system called National Health Service, where 92% of the people take their issues to that public facilities. 92% of people in UK are treated by public hospitals, much better than our Apollo hospitals in the UK. And we have a different model called Cuba. Cuba, it's a different concept of healthcare, where the government of Cuba takes care of all the healthcare, all the education, health education, plus the healthcare as well, where one doctor is being given for about 3,000 population. So the doctor visits the people. The people that don't visit the doctor visits the people, and then every year they do a checkup for a BP or anemia or diabetes, so that if they are found, they are treated then and there, not to let it pass a diabetes to become a heart failure or a coronary issue, so future. So the concept of a preventive and a promotive healthcare is a need today. Thank you.
Good afternoon. I shall dwell on two things. What is the current state of healthcare in the country? Dr. Sunil Chandy has given you an excellent and fantastic outline of that. So let me move forward. Yeah, sorry. When you look at that, you can see it is like a triangle. The quality, the accessibility, and the cost. So when you look at the map of India, it's a beautiful country. And I have traveled from Kashmir to Kanyakumari and from Gujarat to Manipur. And you see the diversity there. The same diversity also exists with regard to healthcare. In the previous forum, we were talking about religion and education. What is the religion for all of us? It is medicine. What is education? To save lives. That's our motive. So when you look at the union budget last year and the union budget this year, I'm sure that our previous honorable minister would know that. The union budget, the overall health budget has increased from Indian rupees 39,879 crores, that is 1.9% of the total union budget, to an Indian rupee of 48,878 crores, that is 2.27% of the union budget. Can we be healthy?
That was before the B. There's a B and a RE.
Right, okay. So now we have a neighbor called China. Previous speakers were talking about China. Yes. When you look at China, see, they are moving forward in getting Olympic medals. What is happening? Why is that? And we are just struggling and dragging our feet to get even a single gold medal. The reason is that they are provided better health care from a very young age, and they are trained to work on Olympic medals and whatever, whether it is medicine or whatever it is. So we are lagging behind. We all know that. So we have difference in accessibility, we have difference in quality, and the cost has already been alluded to by Dr. Sunil Chandy. Now, beautiful country, look at that. And I just have a success story which I have shown on the lower part. I was thrilled being an international advisor to the Royal College of Physicians of London. We have meeting once in 2 years, and all the leaders come from across the world. And one of the gynecologists, white man, was speaking about Kerala. The lowest infant mortality rate, the lowest maternal mortality rate. Why? He said that it is all because of literacy and education. We are lacking in literacy and education. You go to different parts of the country, there is no literacy, there is hardly any education. And as we alluded to, people go to the streets, even at a younger age, to earn a living and to make their livelihood. So Kerala, if you look at that, it is a model. Don't be pessimistic, be optimistic. There is a model state in our country. Even though the politics changes there, they offer one of the best healthcares in the country. And when you look at Northeast, I have traveled. 5 states in Northeast do not even have a single kidney specialist. We have the entire South Asia region, we have only 1 kidney specialist for 1 million people. And for India, we are slightly better. We have 1 kidney specialist for 750,000 population. So look at the healthcare index also. When you look at that, Kerala is highest, and also the longevity is highest in Kerala. All this is because of better healthcare. Move on. This is showing the GDP of India on the red line, and the other one is the purchasing power parity. You see a widening of that graph there. And also see at the bottom, 12.4% of the total population, approximately 172 million people, taking revised poverty line, that of 134 rupees a day. So how can they pay for their healthcare in a private setup? See, we have 2 types of healthcare setup. One is government, the other one is private. In private, you have private, not for profit like CMC Vellore. I tell everybody, I was trained there. Sunil Chandy is a big person. I was trained there many years ago in the 70s. And I feel that every student of medicine, after they pass, should spend at least 1 year in CMC hospital to learn about the ethics of medicine and the work pattern. Now, when we look at the healthcare spending in developing countries, look at India. As Honorable Minister has already said, see the government spending. Can we provide healthcare to all these people? No. See the private spending. How many people can afford in the private? And the same applies also for other developing countries. And last week I was in Sri Lanka 2 weeks ago. But Sri Lanka has completely eradicated malaria. Is it possible in our country? I don't think that. Every night I get bitten by mosquito. My immunity is good, so I don't get malaria. I never got malaria. Okay. So look at that. A small country like Sri Lanka has eradicated malaria, similar to what we have done with polio. So this is the state of affairs with us. And when we go doctors per 1,000 people in developing countries, when we look at that, see on the left-hand side, 0.7 doctor per 1,000 population in India. There is a critical gap. Our population is increasing. We don't have enough doctors, trained doctors to take care of them. Looking at the medical colleges, medical schools. So you look at the discrepancy between different parts of the country. You are looking at North India, West India, Central India, South India, East India, and North India. So why healthcare is better in the advanced 4 states in the south? Because we have more doctors, we are training them, we have an institution called the CMC hospital where a lot of the people across the country and across the world were trained. So they provide the best medical care. Now, looking at number of beds in rural versus urban government hospital. See that on the left-hand side, you can see that the numbers are very small in rural areas where most of the Indians live in the rural area, not in the urban areas. So there is a gross disparity there also. How do we do that? I come from a village in Kerala, central Kerala. I still remember the first primary health care center was opened about 55 years ago when I was a school child. And when I see that primary health care center, nothing more has happened. It is still the same, stagnation. So now, let's look at the issues facing us. Reasons for poor health quality of healthcare in rural areas. One is non-availability of diagnostic tools and treatment facilities. We are moving in technology. We always praise, when I go outside, I said, we send rocket there, we send the Sputnik there. Recently in the news, 104 rockets were. What about healthcare? There's hardly anything happening. Our people are dying. So, poor infrastructure. Because we don't have water, good drinking water. Kerala is now dry. There is no water. I want to go there next week. There is no water in my well. What can I do for good drinking water? So poor pay scale for doctors and also safety concern. Which are the areas where are safety concern? Especially in Manipur, a lot of insurgency going on. There was blockade and we have gone to Manipur. So there is also question of safety for doctors who are working in those places. The major challenges facing the hospitals, both private and government, grossly overburdened. This is the most important thing. I'm just going to show that I brought it to the notice of our Honorable Minister during the Pravasi Indian meeting, and he was trying to do his best. Lack of standardization of laboratory indicating lack of reliability. You all think that you go and give blood test you will get the best result. No, there's no standardization. It is a tardy implementation of the government policy. They are not standardizing the labs in this country. I'm very upset about that. I'm going to show an example also. Lack of screening programs for non-communicable disease and lack of follow-up of patients regularly resulting in complication. Now, I would admit that all doctors are exposed to TB. When I worked in CMC Hospital, Vellore, 1995, as a medical student, everybody speaks on you, whether it is the rich or the poor. I was found to have a lesion in my lung. And then I took care of that. I treated it. So here there is no screening program. When I went abroad, I had that scar. So in Canada, America, everywhere whenever they had to screen me. Why? Because when we have a person, index person with TB, we only teach them to take care of them, not to screen the immediate members of the family. They are not screened at all. So this is a major issue in our country. So tuberculosis spreads, only the person is treated. This is a gross laboratory error. What is creatinine? Creatinine is a measure of your kidney function. It should not exceed in a healthy male more than 1.1, whatever your age is. And in a female with less muscle, it should be less than 1. Here is a report. You can read it, the reference is given. In a private hospital in Andhra Pradesh, a person's creatinine was reported as 61 milligram. I have never heard this in my life. And they took him for dialysis. And it was a purely lab error. And when they checked it, he was given 2 dialysis. And then they found out the mistake that this man did not have kidney failure at all. This shows the tardy implementation of labs which are not standardized in our country. So what is happening? This highlights the need for standardization of laboratories and prevent the mushrooming growth of diagnostic centers without quality. Government spending for standardizing laboratories, establishing regulatory bodies to oversee the cost and quality in India to prevent unnecessary treatment. Now, sorry about this busy diagram. It shows about the communicable and non-communicable disease. Unfortunately, kidney disease is not shown there. We had a publication in Lancet last year. So we found out that 15% of the Indian population has chronic kidney disease of various stages. So it could be stage 1, never known, or somebody who comes for dialysis. So this is something, which is not there. So we have both communicable and non-communicable diseases, and it is highlighted, and you can see by the year whether it is declining or increasing. So I just want to say that, okay, be optimistic about India, because we have success stories. Don't be pessimistic. And we all have to work together. Young people sitting there, many of you are doctors. Please look forward to India. India is mine. I am an Indian. I need to work for that. We have diversity. We have problem with accessibility and quality. Thank you.
Thank you. It was a great discussion, and we spoke about, how government spending is much lesser compared to the private spending in India. In fact, when you take US, one of the main agenda of their political discussion will be healthcare, unlike in India. In US, they talk about Affordable Healthcare Act, which is commonly known as Obamacare on the previous government. But in India, healthcare never comes on politics, never comes on any issues. For us, political issues are different. Those issues are not related to people. But what people need are not addressed by politicians most of the time. So let's take 2 quick questions because we are already running late of almost more than 20 minutes. So 2 last questions.
Okay, very quickly, your name and in which capacity you're presenting for your question. Can we pass the mic, sir, please? Yeah.
Good morning.
Good afternoon, sir. My name is Praveen. Dr. Anbumani and Dr. Georgi, both of you emphasized on the importance of education also when it comes to health. So, is there any possibility where we, all the hospitals, all nurses, doctors, take responsibility of going out and teaching children? At least, each doctor, each nurse takes responsibility of training at least 100 children a year on prevention awareness kind of programs, instilling healthy habits. Sir has said nutrition, environment, sanitation and clean water and all. So that kind of habits can be instilled in children. If doctors say it, maybe students will take it more seriously. Can that be done, sir?
See, doctors' work is to treat patients in the hospitals. For children, there are two things which should be done. All the children in India should be screened for eyesight, for skin diseases, for anemia, for health, BP, blood issues, all. Every year, the children should be screened. All the children in India should be screened. School health program. Second is, there should be a subject called health in our education. And that concept should be right from about what ill effects of smoking, alcohol, or what is HIV, AIDS, or what are the other issues, healthcare. Plus, yoga should be inculcated in all these schools in India. So we need a concept of awareness plus a promotive concept in the schools. But I don't see doctors going to schools and because they have more important work than to treat them. So that is much needed here. So that our education should be augmented on health.
Thank you. And one last question.
Can I just add to that? See, I think we have to change our curriculum in the schools. There should be more thrust on healthcare, how to take care of your healthcare, even the secondary schools also, so that would have an impact on children's education and better health.
Thank you very much. One last question before we quickly move forward to the next discussion.
I'm Saundarya from Savita Engineering College. My question is, from the starting of this section, we are talking about the investment on the hospitals and for the healthcare. But actually, for the investment for the healthcare is up to some extent. But I want to invest, our government should be investing on reduction of those diseases, those causes which are occurring actually. Why do they don't? Because the question is, when we, always my grandma or grandpa is telling like that, from when the generation of grandmothers or grandfathers, there's no diseases that much. They always say, this generation is having that much of diseases which they are not on that generation actually.
See, this is exactly what I said, just investing in hospital doesn't suffice. You need to invest in nutrition, clean water, drinking, environment, sanitation, all that. You invest in all that, you will prevent people going to the hospitals.
Actually,
so that is the concept of prevent. Plus, you do away with tobacco, you can save 5 lakh people dying out of cancer every year in India if you do away with tobacco. If you do away with alcohol, you can save 18 lakh people dying every year in India. So that again, you have to take a little difficult policy on that but it's going to be a little difficult. So mostly on the preventive part, the investment should be there. So that is which I also said earlier.
Actually, regulation of taking a regulation in the government for investing in healthcare or a hospital can be taken for some. On those days they were using Ayurvedic. We can make an awareness for the people to make that.
Exactly. This is the preventive and a promotive healthcare. It's a concept called a preventive, where awareness concepts should go on a healthy living, healthy lifestyle, healthy living, rather than coming later. Because a concept like yoga, yoga is founded in India, exported to America, imported back to India. Because we follow the Americans but the yoga was scientifically validated in America, so that is why yoga reduces hypertension, diabetes, mental stress and all these things. Now we do yoga here So these types of awareness concepts should go around, and this is something which is need of the day of a preventive and a promotive healthcare.
So thank you so much. I think we will call it a day. And just to add one more point with what you said on preventive healthcare, when the former minister, Dr. Anbumani, spoke, he himself said that it's hard to make changes in the healthcare system in India. So friends, realize that it's hard to change the healthcare system, but you can take care of your own health and make sure you don't end up in a hospital. So have a healthier lifestyle and avoid hospitals. Thank you.
Thank you very much for a very informative session. May I request our editorial director, Mr. Prabhu Chawla, to kindly join us on stage and felicitate the dignitaries. So right at the beginning, we asked them a very pertinent question. Is India investing enough in healthcare? And all of them unanimously, vociferously said, absolutely not. Preventive and promotive healthcare is what we should be looking at. And change can begin from an individual and start at home is something that we would really like to take away from this discussion. Thank you so much for being here and really giving us a lot of information that we can process and ponder about. Thank you very much. A quick group photo opportunity before we move forward to the next session. We're starting right away. There are absolutely no breaks, but I'm sure you'll feel really